Welcome to Aging Better in Uncertain Times. I'm Gord Martineau in studio alongside Dr. Fabio Varlese. Here we help you keep informed and up to date on the latest in science, medicine, and technology that helps us all age better in these uncertain times.
In terms of medical advances, I would say they've been modest in the last 20 years, but nonetheless, there is a increased desire and increased awareness among elderly in particular about wanting to remain sexually active as they age. It's a baby boomer phenomenon like everything else.
Hi, everybody, and thanks for joining us on our weekly guide into living a better, healthier life so we can all experience aging better in these uncertain times. Throughout this series, we're going to examine the best ways to prepare ourselves for the future. What's the best advice for our overall health? We're going to look at every aspect affecting your life, and that means physical, mental, financial, nutritional, and medical. We'll cover all the bases. To do that, we'll supply you with high-value information from the leading experts in each field. And by that, I don't mean just everyday opinions. We will introduce you to the leading experts in each field, men and women who have studied, worked, and who teach at the highest levels. You have questions, we have the answers. Joining me here in the studio, Dr. Fabio Varlese, a specialist in internal medicine and geriatric medicine. He's the Vice President of Medical Affairs and Chief of Staff at Runnymede Hospital, Staff Specialist at Baycrest Health Sciences, and Dr. Varlese also an Assistant Professor at the University of Toronto. Dr. Varlese, we've been told over and over again, but we'll get into more of the specifics, that a healthy relationship relies upon a healthy sexual relationship.
Yeah, they're intertwined. I mean, and also it's important to say that it's a myth that sex fades away with aging. Mm-hmm. I'm always welcoming questions in my day-to-day practice from patients who are aging about issues related to their sex life, sexual performance, etc. But and when we get into the medical issues related to being able to perform sexually, it's only one aspect that needs to be addressed. And many times we have to rely on specialists like Dr. Neil Fleschner today to address the medical concerns and collaborate with a urologist who brings to the table an important information and important ways to address issues. But the psychological and emotional implications do play a major role. So the quality of a relationship is also important, and being attentive to the very specific aspects of a relationship, because your emotional well-being has a direct impact on performance also. So hopefully today we'll be able to bring to the table all sorts of pearls of wisdom in how to have a positive impact on a relationship, on the sexual aspect of it, because there's also health benefits from a sexual relationship, and a healthy one.
Yep. So when there isn't a healthy sexual relationship, it impacts on the relationship in general and often leads to a breakdown, either in communication or a breakdown in the whole relationship itself. And let's bring in Risa Heft. She's a lawyer specializing in family law. Risa, welcome to you. And coronavirus, COVID-19, has really impacted every aspect of our society. And, you're seeing, I'm sure, an increased divorce rate because of the stresses that are involved in relationships. How significant is a healthy sexual relationship or an unhealthy one in the breakdown of marriages?
So I don't think that the sexual relationship is what breaks down a marriage, because it's very often people come to me, they're still having sex with their partner, but they are getting a divorce. And then other times I'll have other couples who come and they haven't had sex with each other anyways, at least for 7 years or longer even.
7 years?
Oh, yeah. I had a couple once where she slept on the couch for 7 years.
Good Lord.
Yeah.
That's rather bizarre. When is an unhealthy sexual relationship? How often is that the cause of a breakdown in marriages that you've seen?
So I'm going to say an unhealthy relationship would probably include having an extramarital relationship. Mm-hmm. I think that would bring an unhealthy aspect into a marriage. And of course, that is not a main cause of divorce, but it certainly is a significant cause of divorce when one partner finds out about the other partner's relationship.
Let's bring in Dr. Neil Fleshner. He is a professor and chair in the Department of Urology at the University of Toronto. Dr. Fleshner, you are dealing with urological issues. Erectile dysfunction is a big one, obviously, for males. And what are you seeing there? Are you seeing a lot of it, or are there significant treatments available?
Well, yeah, I think there's been a real societal change about understanding, as Dr. Varlesi had mentioned, that couples do engage sexually till well in their late 70s and 80s, perhaps even more frequently than we think. And there's been, a fair amount of societal awareness around the problem. And I think that's brought a lot of it out of the dark crevices, if you will, of our society. And certainly, the major breakthroughs, which in some ways are great and some ways aren't, still remain the PDE5 inhibitors, Viagra, Cialis, and those drugs, which really are now almost 20 years old. So in terms of medical advances, I would say they've been modest in the last 20 years, but nonetheless, there is a increased desire and increased awareness among elderly in particular about wanting to remain sexually active as they age. It's a baby boomer phenomenon like everything else.
And a healthy sex life means good health overall. They are inseparable, are they not?
Yeah, they are. And I think I look at it as bidirectional. I mean, I think a healthy sex life, is usually associated, although not always, of course, with fitness. It's associated with caring how you look and looking after yourself in terms of diet and lifestyle. But it's also bidirectional in that sometimes erectile dysfunction in an aging male is one of the very first signs and symptoms of atherosclerotic disease, the impending heart attack, for example. And the arteries that feed the genital area in the male are the smallest in the body. So usually the first, if you will, function to go in a man with atherosclerotic disease is actually his erectile capacity. And it's always said that if you see particularly a man in his 40s with what we call vasculogenic impotence, or meaning poor blood flow to the penis, that patient should actually go see a cardiologist because it's potentially a harbinger of a more significant overall health event like a heart attack or a stroke in the future.
Risa, when you have clients coming to you, do you discuss their sexual relationship with their partner? And if so, I mean, do you feel sometimes you're in the position of being a therapist or wanting to refer them to therapy? How do you deal with this?
So, yes, people overshare with me for sure. And they absolutely do tell me about their sexual relations. And I always tell people that when you practice family law, it's 90% psychotherapy and 10% law. So I do play the role of therapist a lot, notwithstanding I tell my clients I'm not trained to do that. And I do try and refer them to therapists usually.
But you're in a position where the person comes to you and you hear their story, and do you say to yourself in your mind, this one's over, there's no going back for this? Or do you see turning the situation around perhaps?
So no, it's not my role to turn a situation around. And I have done it on a few occasions, but in general, by the time people show up at my doorstep, it's over. And if I saw any inkling that it wasn't over, then absolutely I'd be sending them to marriage counseling. And I do recommend marriage counseling anyways, even if it's, just to help them get through this particular part of their life.
Neil, have you seen the onset of COVID-19 reflected in the work that you do and in the studies that you've seen? Is it now a much larger factor in what we're seeing in terms of dysfunction or the breakdown of a healthy sexual relationship?
Yeah, I must admit I'm not seeing it as much. I certainly, in other aspects of my job, the cancer space for sure. I think at this point, I am not seeing that as yet. And if anything, because of the sort of prioritization of more life-threatening medical problems that we're seeing, if anything, I'm probably seeing less of it, which is of a concern. And it does make you wonder what is going to come out of it, which is sort of what you alluded to when you open the piece about how many people are there, with impending marital breakdown and sexual dysfunction.
There are studies out there, and we've seen one in particular, one most recently, where it's a myth that a woman's sexual desire or desire to have sex kind of fades as she grows older. That apparently is absolutely untrue. When it comes to men, is there a point in their lives where the act of having sex with their partner kind of is, wishy-washy?
That's a great question. The reality is men's particularly sexual desire and sexual capacity, unlike the female, and we're just talking now here sort of biologically, I'm not talking around equity or anything like that, but there's no doubt a male is built to procreate, and it's driven by testosterone. The world record is 108 years old. A man has fathered a child. So there actually is absolutely capacity, and there is absolute desire among most men. And I think the other important part to recognize is not all sexuality is certainly men on female penetrative activity.
Yeah.
There's a lot other aspects of sexuality. It's one of the most interesting things I've learned over the years is I sometimes see men discussing prostate cancer surgery, of which erectile function can arise as a not infrequent side effect.
Mm-hmm.
And even though I have men who barely have intercourse, barely have sexual activity, the thought of losing it still is very bothersome to them. And it's quite interesting because I think even the men who don't have much sexual activity, maybe they wake up that day and they hope today's the day type of thing. And actually losing it, which, on a sort of on a surface thought basis seems silly. When you talk about sexuality, it's a darker part of the brain and it's less understood. And this is something I've witnessed time and time again after being in practice over 20 years.
Is this, losing the ability, is this something a man considers emasculating? And that's why they absolutely, some of them don't even want to think about it?
It is absolutely. And there are certain men who don't want to hear about sometimes life-saving procedures or surgery or therapies because it can affect that aspect of their life. There's no doubt about it.
Yeah.
But again, I think losing the sexual capacity, again, is more than just the actual losing the ability to have a sexual relationship. I've talked to some men, their fantasy life, their dreams, other aspects of just sort of healthy psychology can be affected because they don't have the capacity to perform in the bedroom, or at least even though it's really not even in their lexicon. It's very interesting.
Risa, because you're a woman, is your clientele almost exclusively women? Do you have men coming to you with issues of divorce?
Actually, I have more men than women clients.
Really?
Yeah. I'm not sure exactly why, but I suspect a lot of men perceive a woman to be a better family law divorce lawyer than men would be in a courtroom.
And have you seen the overall rise in the number of divorces that are coming into, or at least the cases that are coming into your office because of COVID, when people are forced to live together, and not only that, because they're in lockdown, they're spending all day with each other, and discovered at some point that they don't really get along that well?
In the 18 years that I've been practicing family law, I have never been so busy. It's very much COVID related.
Yeah.
It's partly, as you just described, that people all of a sudden are now locked down. They're together. They're way too much FaceTime, and they realize that they're just not happy. That's, I think, one element. I think the other element is that there was probably a lot of marriages who were on the brink anyways.
Yeah.
But, when you're busy, you don't have time to deal with things. And now with lockdown, people have more time on their hands and therefore more time to deal with the issues that they're facing.
Do you get back to that age-old question, are we meant to be monogamous when you see so many divorces?
I think we are. I'm a big believer that we are. I think people, monogamous can mean just one person at a time. I don't know that we have to have one person for our whole life. And I think at a certain point, people, especially after children are gone, they change, their interests change. and maybe looking for the next phase of their life, which may not be the same as the last phase.
Dr. Verlese, you have patients coming to you, and of course they've got issues, the stresses of normal daily life, COVID exacerbating the situation. You got erectile dysfunction, and issues like that. Like, you must find yourself being in the position of a kind of a therapist in a way.
Oh, that's a guarantee, I can tell you. A patient that comes with these types of problems deserves really a thorough and comprehensive assessment, because we're really looking at various aspects, all the medical aspects that are involved with erectile dysfunction. We're looking at the psychological, emotional issues. We're looking at medications that could be contributing to this. And so, we're looking at a whole array of things. And I will tell you that the stats are pretty clear, though, that, for example, in men who are single, they tend to not fare as well as men in a relationship.
Why is that?
Well, it looks like that, a healthy relationship really gives the types of health benefits that we all deserve, men and women. But it's very interesting to notice these statistics. And there's a bit more increased illness. There's higher opportunity for mental health related issues. And that seems also kind of impact on their own longevity.
So when you see that, plus the imposition of COVID-19, which adds even more stress, then
absolutely
the condition becomes exacerbated.
Exacerbated. We're seeing more suicide. Unfortunately, there's a lot of things that COVID is bringing on. And we need to be very, very attentive as clinicians, to look at this and to really be in a supportive role, to really understand what could be the factor or the factors, as Dr. Fleschner is pointing out. It's multifactorial. Yeah. So we need to be very comprehensive in the approach that we take in order to have the type of outcome that we wish for our patients.
Risa, you mentioned the large number of men you have coming in to seek your advice or your counsel or to have you handled their divorce. Are they okay, or are they reluctant to speak to you about, hey, you know what, I can't have sex with my wife anymore. I don't see any point in this relationship. Do you get to that stage?
So I'm going to say, as a woman, I don't think a man's going to walk into my office and have that conversation with me. I'm there as their lawyer, notwithstanding they share a lot of information with me.
Yeah.
To date, I'm going to say I've never had a man, maybe once I've had a man tell me about any sexual dysfunction that he was suffering from.
Mm-hmm. But obviously it's a hugely important factor in any successful relationship.
Oh, absolutely. But I'm going to say the women would share information with me like that.
Why are women more forthcoming than men?
I think women are trained or taught at an early age to be communicators, and so when they're sitting in my office, they're very. It's very easy to get them to communicate exactly what's going on. So they definitely share a lot of information. The men are much more reluctant. And I'm going to say the men are actually even reluctant to share basic information. I'm always looking at my men clients and saying, "Why didn't you tell me that before?" When I hear from the other side some detail.
And Is COVID-19 one topic that they often come in with? Like, do they mention, okay, you know what, this COVID thing has really opened my eyes to the fact that I can't get along with my partner and I see no way through it?
Yeah, absolutely. I'm hearing that regularly, that I didn't realize how unhappy I was until COVID came and I had to stay in the house for 6 months.
Well, that's an unfortunate situation, and too bad we have to sum it up that way. But thank you very much for your time today, Risa.
Oh, my
really
pleasure.
Appreciate it. And Dr. Fleschner, good luck in your work, and thank you so much for your insights and the issues you've been able to discuss with us today.
Pleasure. Thank you very much.
Some final thoughts now with Dr. Varlese's prescription to aging better. We've learned, actually, we've been reacquainted with the fact that a healthy sex life means a healthy partnership. But, people have to learn to adjust their lifestyles if they have underlying conditions, if they have weight issues or blood pressure issues. See your doctor and be straight with him or her and get it together, and you can move forward.
Well, definitely. In fact, that is the advice I think that everybody should leave this episode with, and that is to seek medical attention. Now, these are topics that are sometimes difficult to open up with your own clinician, and it's important that you do, but at the same time, a clinician also has to be able to open up that type of discussion, because if we're really focused on the health of our patients, we need to know that they're also having healthy relationships, healthy sex lives, because it goes hand in hand with, your overall health. And so it is a myth that that sex fades away with age. There are all sorts of problems, as we pointed out today, that need to be addressed whenever necessary. And there's a lot of medical issues, and we had a great guest today that went into the details. But the bottom line is that once you've ruled out all of those, then it's important. You need to seek a relationship counselor. You need to look at the quality of the relationship, because they're intertwined. It could be a medical problem bringing on a negative impact on the quality of your relationship, and vice versa. Also, it's the relationship that could have a negative impact on your sex life.
And as we wrap up today, please, folks, get a flu shot. The information is at myflushot.ca. Questions about Aging Better can be emailed to info@agingbetter.ca or by visiting our website at agingbetter.ca. Aging Better in Uncertain Times, brought to you by Delos, Runnymede Health, Jewel 88.5, L'Oreal, La Roche-Posay, Vichy, Avicana, and Sanofi Pasteur, in part through an educational grant. Be sure to drop in for your next doctor's visit on Jewel 88.5, Sundays at 8:30 a.m. or at jewel885.com. Until next time, I'm Gord Martineau with Dr. Fabio Varlese, along with producers Dominic Schulo and David Sursta. Be well and stay safe.